Hey guys, welcome to my first ever Q&A video. If you guys like my channel, please make sure you subscribe and also turn on the notification bell. So one of you guys asked me to tell a bit about myself, so I guess I'll do that first. My name is Arunika, obviously. I'm 28 years old, and I'm pretty sure you must be wondering why I'm 28 years old. The reason is, in 2013, I joined the Cyber Medical faculty, and I guess I don't have to go into detail about what happened afterwards because I'm sure all of you know. So yes, our university got abolished, and then we were transferred to KDU. There were so many delays along the way, so yeah, that's why I'm 28. This is actually the 8th year of medical school. So I guess the next question I'm going to answer is how do I find time to edit and balance studies? It's a good question, but to be honest, it's the one that even I really don't know the answer to. So I guess a couple of things that helped me was that I planned ahead a lot. For example, if I know that I'm going to be super busy or if there's an exam coming up, what I would do is I would actually plan and film something the week prior or 2 weeks prior so that I know I would have something to upload. And also I switched to editing on my phone on those days. Obviously I have my phone with me wherever I go, and it's relatively easier to edit, less complicated when you're editing on the phone. And also I just did like very simple edits, basically cut and stitch kind of videos, no fancy edits, simple basic editing. I think that really helped me. But I've got to say, even using your phone and doing simple edits, it still takes a lot of time to edit a video. And then editing stuff on my phone, it took me maybe like 4 or 6 hours per video, because anyone who edits videos knows there are like little things that you have to fix. I guess the answer to this question is that it's not that I was very good at time management, it's not that I really organized my time or anything, but I got lucky and a lot of things helped me do this. For example, when we started professorials, it was right after the first wave of COVID, and then we went on to have a second. Clinicals got interrupted so many times that in the end we had more free time than usual. Usually in the final year you do like 8 weeks of professorial appointments for each subject. Because of COVID and all the delays, I was told that some faculties actually cut down this duration from 8 weeks to 6 weeks, but our university didn't do that, so we didn't have 8 weeks, so we actually had 10 weeks for each subject. So imagine how long it took us to finish this, and on top of that, like I said, it was interrupted so many times. But I guess I benefited from that a lot. That meant I had more time for things like YouTube. Most of the lectures were done online, and only the patients that needed admission were getting admitted, and the number of students in the hospitals were being limited, and we had to take turns. So yeah, there were like lots of factors that contributed towards me having extra time during this year that were like totally beyond my control. And so yeah, to answer the question, I think obviously planning ahead and pre-filming videos helped a lot. But at the end of the day, why I could do this was actually due to things that happened due to the pandemic, and also I feel like it was because I actually chose to put in effort and time into YouTube. So I guess what I'm trying to say is that it wasn't really because of my excellent time management skills that I was able to do this, but it's because I purposely chose to dedicate some of the time that I should have been studying to this. I really feel like I put in a lot of effort and time and hard work into building this channel to what it is today. And I guess you could say most people in the final year of med school wouldn't have chosen to do that with their time, but I did, and I don't regret it. It was worth it, because honestly this channel has helped me so much, especially through those times when we were home again. This saved me from just sinking into a depression or getting frustrated. editing on my laptop, I edit using Filmora, Wondershare Filmora. If I'm editing on my phone, I use several apps, but mainly I use InShot. It's a really great app. It's free, easy to use, it's easy to figure out, it's easy to learn. So yeah, that's one of the best apps in my opinion. Someone asked which year I enjoyed the most and which year I enjoyed the least. So I would say the year that I enjoyed the most was actually my final year. That is not to say that all the other years sucked, but like I said, our journey in medical school was way different from anybody else's. Yeah, but like lots of dark, depressing periods, times where things were uncertain and stuff. So I feel like that really stained my experience in medical school. And after spending so long in medical school, it was a relief to be finally in finals. There's a sense of peace with this, and also I started YouTube, like I said. It was my least favorite year. I think I was in like third year or fourth year. See, it's like a huge blur in my head. I don't really remember the timeline, but I think the worst year was when my previous uni site got shut down. I honestly don't remember much, but I remember being super depressed and just hopeless. So that was really bad. Another similar question I got was, what's the favorite thing and the least favorite thing about medical school? Favorite thing is, let me think. I think as medical students, we get to form like a special bond with the patient. Patients actually find it easier to open up to medical students than to the doctor or consultant. When you're in medical school, you have the opportunity to actually form like a really different kind of a connection with people. I guess when you're the doctor and you have so many patients to take care of, the time they get to interact with the patient is very limited, and you actually have a bit more time than that. And I don't know, at least in my experience, I feel like I've been able to have like some sort of a special connection or a bond with my patients. And also the fact that whatever things that you thought were cool before going into medical school, you actually get a chance of seeing them for the first time. The excitement that you get when you do something like a procedure or go for your first surgery, it's a very short-lived excitement, but it's always cool when you see things for the first time. The least favorite thing is the medical field is generally very resistant to change. There's like a lot of things that probably came from like the 1960s or something like that. Like a lot of things that should have changed with time, but they just haven't. One thing I really hated as a medical student is the fact that there is such an established hierarchy in the medical field, and obviously the medical students are at the bottom. The point is that no matter what your title is, your job is, how educated you should treat everyone with the respect that they deserve. Someone asked me why I wanted to be a doctor. So I think it's a very special thing that you get to help people when they're in their most vulnerable states, when they're still really get to make a significant impact in somebody's life. There's definitely that aspect to being a doctor, which is obviously, I guess, why most of us choose medicine. By that I don't mean that you have to be a doctor to help people. There are so many other ways of helping people, and I feel like every job contributes to society. So one of the other reasons that I chose medicine was because I think I was inspired from a very young age thanks to my parents who are also in the health sector. So from like a very small age, I watched how hard they work and watched what they get to do every day, and that really made a lasting impression on me, I guess. I mean, they never forced me to medicine, they never asked me to do medicine, but I guess they played a major role in making me choose medical school because my inspiration came from them. So someone asked what happens after med school. So the short answer to that is after medical school you have to do your internship. So you have 1 year of internship. After that you are fully licensed to practice medicine in Sri Lanka. I guess a couple of you guys asked about certain medical specialties. What I have to say about that is if you want to be a cardiologist, pediatrician or whatever, these are actually not things that you choose during medical school, they're actually postgraduate studies. So after you get your MBBS degree and finish internship, you have to do further studies to specialize in something, and that I guess takes about 6 to 8 years or something. So a couple of you guys actually asked me a bunch of questions about KDU, and honestly I don't think I'm very qualified to answer those questions because, like I said, we were transferred to KDU, but I'm pretty sure the information must be available in the official website, so make sure you check it out if you're really interested. Our situation was very, very different from everyone else. So got another question from somebody who was engaged to a doctor. Asked me whether doctors should marry doctors and whether it's true that doctors are only happy when married to other doctors. Honestly, I really don't know the answer to that. I guess it depends on your relationship. I can definitely say there are so many doctor-doctor couples as well as doctor-non-doctor couples. So many of my friends are married to people who are not in the medical field, and that's all I can say about the matter. It is, and the rest totally depends on your relationship. I don't know. It's a good question because there are plenty of times I felt like giving up when you're in a very intense field like medicine. It's gonna take a toll on your mental and physical health sometimes. So just know that everyone has those moments where they really want to give up, but most of the time they are just temporary feelings and you would feel different after a while. I think one important thing is always remember to take care of yourself, your mental health. Whenever you feel too stressed or too overwhelmed by everything, just stop, just take a break. Do not work yourself to exhaustion. It's not healthy. It's okay to take a break when you need it. It's okay to take time off to do other things. Also having a solid support system also helps. Maybe it's your parents, maybe it's a friend, maybe it's one of your siblings, somebody that you can talk to when you don't feel okay. That really helps. I guess it's important to remember that it's something that everyone feels, totally normal to feel that. Just believe in yourself and keep pushing. You will get there. Everything's going to be fine. So my answer to that is physical exercise, because that's what has worked for me so far. If you're too stressed, just stop whatever you're doing and maybe go outside for a walk, maybe cook something, maybe bake something. Just do something that you know you would enjoy, and make sure you stay organized and have a rough plan. That takes away a lot of the stress. I guess that answers the question how to stay motivated as well. Even I lose motivation, because it's easy to lose motivation, especially when things get hard. Taking some time off to do some other thing helps to reset your mind, and never lose sight of why you chose to do this in the first place. It's helpful to maybe remind yourself why you wanted to do it, because tough times don't last, they always pass, and maybe they're not. So that's it for this video. Hope you guys enjoyed it as much as I did. This is my first Q&A and I actually enjoyed filming this, so I'll probably do this again sometime. So thanks for watching. Make sure you subscribe to my channel. I'll see you guys in my next video.